Assalamu alaikum, everyone. Good evening. Welcome to the IMIC Live hosted on the Facebook page of International Medical Information Center and RAS TV. This webinar is brought to you by IMIC and Icon Cancer Center Singapore, along with Banquet, Bangladesh Cancer Aid Trust. Through this webinar, as you already know, that we try to discuss on different health concerns from international experts, along with experts from Bangladesh, to fight this corona pandemic and to create awareness. I am Farzana, Director, International Medical Information Center. We are the Health Assistance Center, through which we are affiliated with different hospitals from Singapore, Bangkok, Malaysia, and India, and try to assist our patient for any advanced treatment management from outside Bangladesh. Unfortunately, worldwide cancer, lung cancer is the most commonly diagnosed cancer. Among all cancers, lung cancer now has the highly mortality rate in most countries. This is the most common cancer in Bangladesh for the men, but women are also suffering from lung cancer. As of 2018 in Bangladesh, out of all cancer patients, 8.2% is newly diagnosed with lung cancer, which the number might seem insignificant, but that is about 12,374 people. So now we know that lung cancer is a concern topic to discuss on it. So today, our topic of discussion is managing advanced lung cancer during COVID-19 pandemic. So we have panel of experts. Let me introduce with you our panel of experts. So we have a doctor. We are extremely honored with the presence of Dr. Tan Yo, senior consultant, medical oncology, Icon Cancer Center, Singapore. Thank you, sir. Thank you for joining with us. First of all, I would like to congratulate you for a big achievement from Bangladesh patients and the speakers who have joined us today. For your information, who is joining with us today, he has been recognized in this year's National Day Honors, awarded with the Public Service Medal. This is a tremendous achievement. He has over 40 years experience in oncology and significant contribution in advancement of cancer care in Singapore. Doctor, just to give a brief note about Dr. Tan, he has graduated from National University Hospital with MBBS, was certified as diplomat of the American Board of Internal Medicine, Hematology, and Medical Oncology. Dr. Tan was the Chief of Medicine and Head of Department of Medicine, as well as Division of Hematology Oncology, Professor of Medicine at the National University Hospital, Singapore. Being the first medical oncologist in Singapore, Dr. Tan had set up the specialty at Singapore General Hospital and National University Hospital. He also held many positions in the National University Hospital, Ministry of Health, professional bodies during the time of being with university. Now, Dr. Tan is a senior consultant of Icon Cancer Center, which is dedicated provider, Australia's largest dedicated provider of cancer care, with a growing reach into New Zealand and Asia. This is the Icon Cancer Center is now the most popular center for cancer care with multiple disciplinary departments. So thank you, Dr. Tan. Thank you for joining with us.
It's my pleasure and honor to be invited for this fantastic webinar. And I want to say hello to everyone in Bangladesh. I'm missing many of my old friends and patients, and it is too bad that this COVID environment and the pandemic has changed the way we do things today. But I hope that through this webinar, we can understand some of the challenges of managing lung cancer during this pandemic. Because as you know, lung cancer affects the lung, and COVID-19 infection affect the lung, and sometimes it is very challenging to know, is this a problem, a lung cancer problem, or is it an infection problem? So we're going to learn from each other and hear from all my friends in Bangladesh. Thank you.
Thank you so much. Let me introduce with our other panelists. We have Major General MD Azizul Islam. Thank you. It's an honor with the presence of Mr. Azizul Islam. He's the Director General of Medical Service, Ministry of Defense, Bangladesh, and very prominent doctor from Bangladesh. And with his currently, he is managing COVID patients in Bangladesh through the CMH. So thank you for Dr. Azizul Islam for joining with us.
Thank you very much.
We have we are extremely honored with the presence of Mr. Nasmus Ahmed Albab, founder and trustee, Bangladesh Cancer Trust, Banket, and he's himself a cancer survivor, and he is supporting patients, creating awareness among the society to survive from this cancer. And we have honorary captain, Captain K.M. Shamsul Alam. He is also a cancer survivor and also a patient of Dr. Tan and Dr. Azizul Islam. So he is internationally taking treatment from Mr. Tan and Bangladesh, supporting Mr. Dr. Azizul Islam to this patient. So first of all, I'd like to hear from Dr. Tan. Dr. Tan, thank you.
Yeah.
So how are you, sir?
Okay. First of all, I think we have to learn to do things differently in this period of COVID, from early diagnosis to treatment planning and to instituting the treatment. As you know, I'm a medical oncologist. I give cancer patients cytotoxic chemotherapy, targeted therapy, immunotherapy. So it is very challenging whenever we see a patient who come to us with cough and breathlessness. We have to try and make a distinction. Is this related to COVID infection, or is it related to underlying cancer? So we often have to take one step at a time, listen, and get certain parameters done. We have to do swab tests and to do the relevant blood tests. And then from there, if we suspect a patient may have cancer, we got to do the proper staging evaluation to see whether the cancer is early stage or late stage, and then to offer whether patients should have surgery or radiation, or to have cytotoxic chemotherapy or targeted therapy. So sometimes we have to do many tests before we arrive at the treatment plan. And I think it is important that all the doctors and all the patients be aware to make the distinction between COVID as well as cancer of the lung. And from there, if the patient has got, unfortunately, has advanced disease, we sometimes have to do either liquid biopsy, where we can take blood and send for molecular changes, or take a tissue biopsy to send for molecular testing. And we have our friend, Mr. Captain Alam, who can share with us later how the diagnosis of the molecular target had made the difference in terms of treating his cancer than if he had just received chemotherapy. So these are some of the challenges we face, and I thought we'll hear from each panel speaker, and then we can entertain questions after that.
Thank you, sir. So I would like to hear from Dr. Azizul Islam, sir. Then I'll come back to Albab, sir, and other speakers. So, sir, you people patients with COVID patients and the cancer patients. So how you are supporting these patients who is suffering from lung cancer or during this COVID situation? What's your treatment management from Bangladesh? I would like to hear from you.
Ms. Farzana, thank you very much for inviting me and allowing me to participate in this learned webinar session. Actually, I know one of the senior-most medical oncologist of Singapore, Dr. Tan, for a long time. I can remember because let us start with the very important and very one of the very important history, encouraging history regarding the history of a patient. One of my patient, possibly Dr. Tan can also recognize. The name of the patient was Saidur Rahman. Saidur Rahman from Dhaka, Bangladesh. The patient was a diagnosed case of metastatic adenocarcinoma. Actually, patient had the extensive metastasis in the lungs. The presentation was like this. And he had severe respiratory distress and oxygen saturation was lower than the normal. So much there was extensive metastasis, and just like the lymphangitis carcinomatosis, and patient was dyspneic. And patient was severely dyspneic. And at that point, what can be done? Actually, it was difficult for the patient to do the question does not arise regarding the surgery, it is advanced stage. Even FNSC or core biopsy was also very difficult. But somehow, one core biopsy was done from either from Singapore or from Dhaka, but the patient was absolutely bedridden. And finally, it was difficult to it was difficult to send the patient to Singapore because patient had severe dyspnea. Actually, dyspnea class 4 or 3 with the performance status of performance status 20%, 25%. So then we send the sample somehow to Singapore through the channel. Dr. Tan is always very kind, and he always advises us to send the samples to talk with us. I had talked to him several times in our telephone, and he told, please send the sample. Let's me do the immunohistochemistry test. Actually, in Bangladesh at that time, we did not have the particular different immunohistochemistry of the lung cancer, like the EGFR test, ALK test, ROS test. These were not available. Only you could do the histopathology and whether it is this small cell lung carcinoma, non-small cell lung carcinoma, adenocarcinoma. This could we understand? We could do it, but after discussion with Dr. Tan, our diagnosis was in Bangladesh it was adenocarcinoma. Then Dr. Tan was very hopeful. He told, okay, Dr. Aziz, please send the sample to me. Let me see what type of whether immunohistochemistry the histopathology has, whether it is EGFR positive or ALK positive or ROS positive. And at the same time, Dr. Tan also told you can, as adenocarcinoma, you can start treatment with a conventional chemotherapy regime. Then we started with pemetrexed and the docetaxel or paclitaxel. So far I remember, pemetrexed with the docetaxel or paclitaxel. We have given one cycle, the patient was improving very slowly. But whenever the sample was sent to Singapore, Dr. Tan took the sole responsibility, and he told there is a very good news that the ALK positive was positive. Can you remember, Mr. Tan?
Yes, definitely. I
ALK
visited
positive.
you after that.
ALK positive. Then at that time, ALK positivity was very known to our country in Bangladesh. But Dr. Tan used to do for a long time, maybe for the decades. But possibly before 7 to 8 years back, I have come to know that if ALK is positive, then there is a drug available in the globe, but it was not available in our country. So Dr. Tan told, don't worry, you give one cycle of chemotherapy, and we have administered, and finally, whenever he found that it was ALK positive, then he told, yes, I have a drug in Singapore, and he told that I am sending the drug through the embassy. We send our people. That patient was also very cooperative. They contacted with the embassy and send some money for the drugs, and the creatinine was sent by Dr. Tan, and that is the first time I have come to know that it is available there, and if ALK is positive, then the creatinine is the drug of choice. And finally,
yes, sir, that is the thing actually. Through Dr. Tan, Icon Cancer Center is helping patient for any medicine, anything, and he tries. From my experience, I know he tries to give it at a discounted rate as much as possible he can.
ঠিক আছে, Farzan, I will make a shortcut. Let me just finish within a very few sentences. Yes. Then we started creatinine. It was collected from Singapore. Possibly the drug was made by Pfizer, Dr. Tan. What was the name of that?
Yeah, it's called Xalkori, or it's a Pfizer drug.
Yes. Xalkori, I have heard the name first time from Dr. Tan, that it is Xalkori is available in Singapore. Then we started the first cycle of the Xalkori to the patient, Saidur Rahman. And by the grace of Almighty Allah, after 2 to 3 years, 2 to 3 weeks, the patient started decreasing the dyspnea, and I have seen almost 90% lungs was clear within 2 to 3 months. And that was a miracle for me. And I am highly helpful and thankful to Dr. Tan. And the patient party was also very happy. However, virtually, it is extensive disease. Finally, the patient ultimately survived 2 to 3 years without any symptoms. The symptom of survival was 2 to 3 years. Finally, patient had metastasis, and patient suddenly died due to the cardiac arrest. However, so I have learned his magical drug from that time. Possibly it is in the back 2014, 15, or 13. I exactly cannot remember the year, but it is like that, or 12, 13. The patient survived several years, and then at Xalkori was very costly, and finally we used to collect from the neighboring country. Then it was a little less costly. So we are highly grateful to Dr. Tan regarding his cooperation, and let us now I will talk regarding the COVID situation. Actually, as Consultant Physician General, Bangladesh Armed Forces, I am the senior most physician of the Bangladesh Armed Forces. I have to look after the whole medical aspect of the Army, Navy, and Air Force. So all COVID patients are treated under the supervision of the DGM's office, and I am the person who is responsible for all the medical stores. And initially, we were very panicked regarding the COVID, and we were actually blank, and the whole world was also in blind. Though the Singapore was doing very good, still they're doing very good in Corona and COVID. But initially, the COVID situation was very havoc in the Iran, then the UK, and the other European countries and America. Though it started from the Wuhan, but the Europe and America, they were affected very much with the COVID pneumonia. But we Bangladesh and the neighboring countries like this Bangladesh, India, the Southeast Asia, we got some time, 3 months time from December, and our first case was detected in March, and in the army it was in April. So we were in a big soup. We were in a problem, but virtually all the drugs. In the meantime, the 3 to 4 months, though there is no the curative treatment, but still, particularly different modalities of the oxygen therapy. For example, the oxygen concentrator, oxygen generator, high flow oxygen. High flow oxygen is very important and is life saving for the COVID pneumonia. High flow oxygen and the ventilation is the last resort. So, in the meantime, we have managed many of the COVID patients with this oxygen therapy, and virtually we also collected the different drugs like the latest drugs of remdesivir, antiviral drugs, the favipiravir, and the inflammatory drugs, particularly tocilizumab. Even bevacizumab also is found to be effective in this COVID pneumonia in our country. And the other drugs, as Dr. Pen is also a physician, we are also using the anticoagulants, the low molecular weight heparin, that is enoxaparin, and sometimes heparin. And anti-fibrotic drugs we are using. But initially, we were very much afraid and panic. But nowadays, in Bangladesh, I must tell the CMH, we have treated a lot of VIP patients, starting from the ministers, the secretaries, and the professors of the different institutions. And you will be happy to know that the DG Health, Director General Health Services of the country, Professor Abul Kalam Azad, was also admitted in CMS Dhaka for the COVID with the COVID symptoms, and he was treated here. And I can tell one or two ministers, for example, our Liberation Minister, Akam Mojammel, he was also admitted in the CMS and treated over there, and he has been cured and discharged now, and he's fine. And another minister, I tell the name, the Minister of the Hill Trucks, Hill Affairs Minister, he was also treated in this CMH, and he was cured from here. And many of the VIP patients were treated. Even at the moment, one of the ministers of Bangladesh, Mr. Asaduজ্জামান, one of the minister of the Bangladesh, he is also admitted in our hospital CMH. So now we are confident, and our mortality is also very less. But initially, we did not allow, particularly the cancer patients who were particularly extensive disease or the metastatic disease. But now we have already started the treating COVID side by side.
That's the good news for Bangladesh. So that is the actually, sorry to interrupt you, that is the actually good news for Bangladesh, that the COVID patients here in Bangladesh is under good care, and the mortality rate is quite less. Rather, we thought the impact could be very, harmful for our society, but it is now quite good. So thank you so much, sir. We'll discuss a lot of things now. So I will go to Mr. Nazmus Ahmed Albab, sir. So, Bhaiya, you are working for the awareness of the society for cancer patients. Awareness, আমরা আসলে যেটা বাংলাদেশে ক্যান্সার পেশেন্ট নিয়ে চিন্তা করি, সেটা হচ্ছে যে স্পেশালি the patient with the ovarian cancer or breast cancer. আদার অনেক ক্যান্সার নিয়ে কিন্তু ডিসকাস করার ব্যাপার আছে, আর লাং ক্যান্সার নিয়ে কথা বললে আমরা চিন্তা করে নিই যে স্মোকিং কুইট করলেই হয়তো আমরা ক্যান্সার থেকে বেঁচে যাব। সো how we can create this awareness and what are the stages of awareness through which we can actually concern our society about cancer? আপনি যদি একটু briefly একটু discuss করেন, since you are a cancer survivor and working for the cancer patients. Please, sir. Thank you. একটু আনমিউট করে নেন।
Miss Farzana, we are live now.
Thank you, Farzana. Thank you all, panelists, Dr. Tan, sir. It's been a great pleasure having you with us today, and Major General Dr. Azizul Islam, sir, Shamsul Alam Sahib. It's an honor, definitely, to be able to speak in a panel with all these luminaries. Today, in this context of awareness, firstly, let me touch one area, that is the fear factor that works all about cancer. Now, definitely, lung cancer is as you can read or as you can know, that lung cancer is the deadliest cancer. It is a fact, and it is এবং এটার 70% হচ্ছে এটার মর্টালিটি। এবং বাংলাদেশে দেখা যাচ্ছে যে সেকেন্ড ইয়ারেই লাং ক্যান্সার আছে ফর মেল, অ্যান্ড ওভারঅল ফোর্থে আছে লাং ক্যান্সার, এবং মেয়েদের মাঝেও এটা এখন দেখা যাচ্ছে লাং ক্যান্সারটা হচ্ছে। এবং আমরা যেটা বিশ্বাস করি যে স্মোকিং ডু কন্ট্রিবিউট টু লাং ক্যান্সার, বাট স্মোকিং একা নয়, আমাদের ইনঅর্গানিক লিভিং যেভাবে করে আমরা থাকছি, আমাদের লাইফস্টাইল সবকিছু মিলিয়ে কিন্তু লাং ক্যান্সারে কন্ট্রিবিউট করছে। এবং তাতে আমাদের পলিউশন আছে, আমাদের এনভায়রনমেন্ট আছে, আমাদের এবং সবচেয়ে মজার ব্যাপার হলো, আমি সিলেটে কাজে একবার গিয়ে আমি যখন জানতে পারলাম যে সিলেটেও লাং ক্যান্সারটা খুব প্রকট, কারণ তারা ভীষণভাবে সুপারি খায়। নাও, লাং ক্যান্সার নিয়ে কথা না বলে আমি একটু যদি ওভারঅল ক্যান্সার নিয়ে কথা বলতে চাই, সেটা হলো যে ক্যান্সার নিয়ে যে ভীতিটা আমাদের মাঝে আছে, এটা কিন্তু আমি অন্যভাবে দেখি। আমরা দেখি ভাবে যে আমাদের ক্যান্সারটা ছড়িয়ে আছে প্রায় প্রতি বছর 2 লক্ষ নতুন রোগী শনাক্ত হচ্ছে ক্যান্সারে, এবং অ্যাভারেজ 1.5 লক্ষ থেকে 2 লক্ষ রোগী মারা যাচ্ছে। আর এটাও ফ্যাক্ট যে 20 লক্ষ রোগীর মাঝে ক্যান্সার ছড়িয়ে আছে। না, আমার যেটা জাজমেন্ট, যেটা আমার গত 9 বছরের অভিজ্ঞতা ক্যান্সার নিয়ে কাজ করার সময় থেকে, যে 3টা কারণে আমরা ক্যান্সারটা আমাদের বাড়ছে আমাদের দেশে। এটা যদি আমরা আমাদের নিজের উপরে নেই, কারণ দিনের শেষে রোগ আমাদের হবে, অতএব দায়িত্বটা কিন্তু আমাদের উপরে বর্তায়। অতএব আমি যদি ভাবে দেখি 3টা জিনিস, একটা হচ্ছে যে ভীতি, ফিয়ার, ক্যান্সার সম্বন্ধে জানবো না, জানার দরকার নাই, জানা যাবে না, এটা একটা সবচেয়ে বড়। দ্বিতীয়ত হচ্ছে ইগনোরেন্স, উপেক্ষা করে যাওয়া। না, আমার জানার যতটুকু উপায় আছে তা জানার থাকতেও আমরা জানার প্রচেষ্টা আমাদের মধ্যে নাই, সেটা হলো ইগনোরেন্স। আর 3 নম্বর হচ্ছে নেগলিজেন্স, যে আমার মনে হচ্ছে দেখা দিয়েছে যেটা আমাকে হয়তো একটা কোনো বড় ইনফেকশনের মুখের দিকে ঠেলে দিতে পারে, সেটা ক্যান্সার নাও হতে পারে। ওখানে আমরা কি করি? নেগলেক্ট করি, সম্পূর্ণভাবে ওটাকে ওভারলুক করে চলে যায়। সেটা পরে ক্যান্সার রূপান্তর হয় না বড় ধরনের রূপান্তর হয় আমরা জানি না। নাও, এই যে 20 লক্ষ ক্যান্সার পেশেন্ট আমাদের দেশে আছে, বা যার যে 2 লক্ষ ক্যান্সার পেশেন্ট মারা যাচ্ছে, তার মাঝে কিন্তু 10% হচ্ছে শুধু সচ্ছল, বাকি 90% হচ্ছে অসচ্ছল। কিন্তু আসলে এই যে যারা আমরা সচ্ছল, যারা 10%, যারা শিক্ষিত, আমরা কিন্তু সবচেয়ে বেশি এই ভীতি, ইগনোরেন্স এবং নেগলিজেন্সের বশবর্তী। আমরাই যদি এর থেকে শিক্ষা না নিই, আমরাই যদি প্রচেষ্টাটা আমাদের মাঝে না থাকে, তাহলে ওই 90% যারা নাকি মার্জিনালাইজড, যারা নাকি সুবিধা বঞ্চিত, তাদেরকে আমরা শিক্ষিত করব কিভাবে? সো আসুন আমরা বাংলাদেশ ক্যান্সার এই ট্রাস্ট কিভাবে কাজ করে এটা একটু আমরা দেখি। সো প্রথমে আমি একটু সাদা স্লাইডটা যদি শেয়ার করেন, তাহলে আমি বলতে পারবো প্রসেসটা যেটা আমরা ফলো করি বা যেটা আমরা বিশ্বাস করি। ক্যান উই হ্যাভ আ লুক এট দ্য ফার্স্ট হোয়াইট স্লাইড প্লিজ? So this is actually to look at the process of awareness. যে অ্যাওয়ারনেসটা আমরা কিভাবে আমরা তৈরি করব। অ্যাওয়ারনেস হলো জানা, মোট কথা মুদ্রা কথা হচ্ছে জানা। সো সবচেয়ে আগে আমরা জিনিসটার ব্যাপারে না জেনে আমরা যদি একটু চিন্তা করি কেন আমরা এটার ব্যাপারে জানবো, আমরা ক্যান্সার সম্বন্ধে কেন জানবো, এটা আগে আমরা চিন্তা করি যে why do we have to know about cancer? What is cancer? Forget about knowing what cancer is. Let us look at why we have to know about cancer. It could be many reasons. It could be the reasons why cancer is so much talked about. It could be the reason what happens when you have cancer. It could be the reason why we should be aware of cancer. So আমাদের মাঝে সেই মোটিভেশনটা থাকতে হবে। সো আমরা কিন্তু যখন ক্যান্সার কে নিয়ে আলাপ জানার চেষ্টা করব, তখন কিন্তু আমরা একটা ভীতির একটা ধাপ আমরা পার হলাম। তখন কিন্তু আমাদের মাঝে ওই সাহসটা আসবে যে আচ্ছা ঠিক আছে, তাহলে আমরা এখন চিন্তা করি যে প্রথমত যে যদি ক্যান্সার কারো হয় মানবিকতার দিক দিয়ে, বা আমার পরিবারে যদি ক্যান্সার হয় তাহলে আমার পরিবারের এর 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 উপক্রমটা কি হবে সেটা নিয়ে জানা, যে হাউ এম আই গোয়িং টু ডিল উইথ ক্যান্সার। সো দেয়ার আর থ্রি থিংস। একটা হচ্ছে হাউ এর মধ্যে আসতে পারে অ্যাওয়্যার হওয়া, আগে থেকে সোচ্চার হয়ে যাওয়া। 2 নম্বর হতে পারে যে এটা সম্বন্ধে জানা, এবং 3 নম্বর যে ডায়াগনোসিসের পরে কি করা। সো এটা হচ্ছে হাউ পার্টটা। এবং যখন আমরা ওয়াই অ্যান্ড হাউটা জেনে যাব, তখনই কিন্তু আমাদের সামনে হোয়াট ক্যান্সারটা কি সেটা আমাদের সামনে ফুটে উঠবে, এবং এতে হবে কি আমরা ভীতির ধাপটা পার হয়ে আসব। আর সবচেয়ে বড় ব্যাপার আমরা যেটা জানবো যে যখন যে আমরা যে যত ক্যান্সার রোগী ট্রিটমেন্ট করেছি যারা সুবিধা বঞ্চিত, যে 100 জন ক্যান্সার পেশেন্টের মধ্যে আমাদের প্রায় 30% সার্ভাইভাল আছে, এবং তারাই সার্ভাইভ করেছেন যারা আর্লি স্টেজে এসে আমাদের কাছ থেকে সাহায্য নিয়েছেন। সো ক্যান্সার ইজ নো মোর a death sentence. As Dr. Khan said, it's not a sentence anymore, it's just a word. So you can survive cancer once you know about it, but all you have to do is you have to know why you want to know about it and how you got to know about it and how you're going to deal with it, and then finally what is it all about. So knowing so if you are early as far as cancer is concerned, you have basically saved yourself. Survival inshallah is imminent. Finally, আর আমি 5টা মিনিট সময় নিব স্টেজগুলি নিয়ে যদি একটু আলাপ করি, আমরা কিভাবে বাংলাদেশ ক্যান্সার ট্রাস্ট এই স্টেজগুলি ফলো করে টু ক্রিয়েট অ্যাওয়ারনেস ইন দ্য ক্যান্সার কমিউনিটি অর ওভারঅল কমিউনিটি। আমরা যদি রেড স্লাইডটা একটু দেখতে পারি। red slide please. So these are the stages through which we can aware ourselves or aware the nation. First of all, আমাদের নিজেকে জানতে হবে। Self, knowing ourselves what cancer is all about is the foremost. You have to know all about cancer first, and then what you do, you communicate with others. It could be your family, it could be the fact that আপনি আপনার মাকে বা আপনার বোনকে যারা বিবাহিত, আপনার মা যিনি অলরেডি আপনার 3 ভাই বোনের মা, তাদেরকে ম্যামোগ্রামের জন্য পাঠানো বা পেপ স্মেয়ারের জন্য পাঠানো, it will actually prevent her or it will aware the entire family about, it could be cervical, it could be breast. এটা হলো সবচেয়ে বড় জিনিস। সো ফ্যামিলিতে আপনার দায়িত্বটা কি? বা বাবাকে একটু সিটি স্ক্যান বা কোনো ধরনের, যদি উনি একজন খুব বেশি ধরনের স্মোকার হয়ে থাকে, তাকে একটা সিটি স্ক্যান করতে পাঠানো, অথবা মাসে 3 মাসে বা 4 মাসে একবার একটু জাস্ট ব্লাড টেস্ট করানো যে আমাদের মাঝে কোনো ধরনের ইনফেকশন আছে কিনা। সো ইন্টারপার্সনাল ফ্যামিলির মাঝে, তারপরে আপনি আসেন টিম বা সোসাইটি, বা সেটা হলো টিম হচ্ছে ইট কুড বি ইয়োর অফিস, যেখানে আপনি আপনার কলিগদের মাঝে এটাকে প্রচার করতে পারেন, অর আপনি যদি একজন ছাত্র হয়ে থাকেন, স্কুল স্টুডেন্ট, বা আপনি একজন কলেজ স্টুডেন্ট হয়ে থাকেন, ইউ ক্যান take this to your students, fellow students. And finally, once you have created this awareness within these teams of corporates, educational institution, your colleagues, তাহলেই কিন্তু সারা নেশন সোচ্চার হবে, সারা নেশন এটার ব্যাপারে সচেতন হবে, এবং সেই সচেতনতাই আমরা কিন্তু চাচ্ছি। এবং ওয়ান্স এই 10% আমরা যখন সচেতন হব, তখন কিন্তু আমাদের বাসায় যে বাসার বুয়া যিনি কাজ করছেন বা ড্রাইভার যিনি কাজ করছেন, তাদেরকে আমরা সচেতন করা, সো দ্যাট তারাও যেন তাদের পরিবার যারা গ্রামে থাকে তাদেরকে সচেতন করতে পারে। সো I have spoken about how Bangladesh Cancer Aid Trust is working, creating awareness, the stages, and যে কিভাবে করে আমরা ফিয়ার, ক্যান্সার কে জানার ব্যাপারে ফিয়ারটাকে আমরা কিভাবে সরাতে পারি। আমি দুটো ব্যাপারে কথা বললাম, আমাকে সুযোগ দেওয়ার জন্য ধন্যবাদ। থ্যাংক ইউ।
Thank you so much, Mr. Albab. That was really informative, because when we are talking about the cancer, the first concern is how to aware people about the cancer. আমরা যদি ক্যান্সার নিয়ে কনসার্নই না হই, তাহলে আসলে এই ডিজিজকে ফাইট করা is not actually possible. So thank you so much. It was really informative to our audience. So I'd like to hear from Dr. Tan. Then I will hear from Mr. Shamsul Alam. First of all, Dr. Tan, since Mr. Azizul Islam was talking about the treatment options and all these things, and you were researching on cancer for last 40 years. So what are the advanced treatment options we have for the lung cancer patients, and especially the patients with the stage 4 lung cancer? They want to hear from you. What are the options we have from you that they can have some hope to be treated, to have a life? Please, sir.
Thank you very much, Fasana, for that very important and useful question. I think basically in the past, when I was a younger doctor, we know of 2 types of lung cancer. One is called small cell lung cancer, which only forms about 15% of lung cancer, and most of them are smokers. And the other one is non-small cell lung cancer, which can be smokers and non-smokers. But about maybe 15 years ago, we found that lung cancer is not so simple. We have many different molecular types of lung cancer and certain ethnic differences. People in the Western population, the Caucasian, the incidence of what we call a molecular change called EGFR mutation is less than 10%, whereas East Asian like Japanese, Koreans, and Chinese have about 50% EGFR mutation. And that made a lot of difference, because those with EGFR mutation, even if they have advanced stage, do not need chemotherapy as the first option. We give them an oral medication called targeted therapy. Nowadays, different generations of it. There are now about 6 different EGFR targeted agent in the market now. And then later we come on another target called ALK. And our good friend, Major General Muhammad Azizul Islam mentioned about ALK, it forms about maybe 4 to 5% of lung cancer. Because if you can identify it, you don't need chemotherapy so quickly. You can give them a tablet. They don't get nausea, they don't get vomiting, their head do not drop and things like that. And then we now also have ROS1. And since then, in the last 3 years, we have a lot of newer drugs that are targeted. And then recently, we also found that immunotherapy is another way of treating cancer, where we stimulate the immune system to fight the cancer. And that's a very important advance. And more lung cancer are now treated with immunotherapy, whether they're small cell or non-small cell. And we have to identify certain features in the cancer that will make it more responsive to immunotherapy. And then we also have a few new, what we call cytotoxic drugs, like what we call pegylated paclitaxel and things like that. But in this COVID environment, the topic of today's webinar, many of these drugs cause reaction to the lung, and we need to always make a distinction whether the reaction from the side effect of the drugs are related to the drug itself, or is it they pick up an infection, as our good friend Dr. Muhammad Azizul Islam has mentioned. COVID-19 is a very common infection now, and I'm very sad to see that in Bangladesh you have a lot more COVID cases than Singapore. At one time, Singapore had more, but now you all have overtaken us in terms of number, and the number of deaths you have in Bangladesh is quite high and quite frightening. Singapore, we now have about nearly 56,000 COVID cases, but we have only less than 28, 29 deaths only. Whereas I think in your country, Bangladesh, we have a lot. So sometimes making the distinction is very important. And you will hear from our good friend, Captain Shamul Alam, when he came to see me about February or so. It was just the beginning of the COVID pandemic, and he came to see me with fever, and we were so afraid that he may have brought COVID to Singapore, but it turned out that he had influenza A, but we still have to hospitalize him to do the swab test and isolate him and make him very miserable. And he was so upset that he had to be kept in the hospital for a few days for us to rule out that he doesn't have COVID. So fortunately, he didn't have, and we gave him the medicine. We did the scan and told him, wonderful news, he's responding to treatment. And that's why he's here to share his story with us. So I thought these are important things that we need to focus about COVID-19 and how to manage lung cancer. Thank you very much.
Thank you so much. Thank you, Dr. Tan. Definitely, you are such a hope for the cancer survivors and the cancer patients. And definitely from Dr. Azizul, lots of cancer patients having a hope, treating very well. So, Mr. Shamsul Alam, sir, আপনি তো এই ডক্টরদের আন্ডার ট্রিটমেন্টে ছিলেন, ট্রিটমেন্ট পেয়েছেন। আসলে আপনি কোন সিমটমের কারণে আপনার মনে হয়েছে যে আপনার ডক্টর দেখানো দরকার, আর এখন আপনার কন্ডিশনটা কি, ট্রিটমেন্টটা নিয়ে যদি আপনি একটু বলেন, আপনার টোটাল এক্সপেরিয়েন্স নিয়ে যদি একটু বলেন ক্যান্সার নিয়ে।
Thank you very much for giving me the opportunity to talk. July 2019, I developed some dry cough, and I reported a doctor. Doctor told me that you have no major problem. You can take some medicine which is antibiotic. During a month, I take the medicine, but no progress. Again, after a month, I reported to the same doctor. He referred me to a pulmonologist. Pulmonologist tested me and told me that you have some allergic problem. It will take a long time. Please take the allergic medicine. After 2 months, but no improvement, I was taking the medicine. And at a stage, I cannot even go to bed and to rise from bed alone. My son taken me to the Apollo Hospital, and a pulmonologist suggest that some test. One of them was CT scan. The CT scan, it was done in the same age. So they find that right side of my rib and lung was white. No rib was thin, but left side is okay. They suggested to take out the water fluid. They tested the fluid and it was pleural effusion. And they sent it to test if there is any cancer or TB symptom. They diagnosed that it is adenocarcinoma, lung right. They give us 2 cycles of chemotherapy. First, it improves me and I can walk alone, no problem. But after some days, my physical condition became very weak. I became weaker and weaker. My son and daughter told me that they will take me to higher cancer center in Singapore. I taken the permission of our Bangladeshi oncologist. They also suggest that you can see the higher center. Then I go to Mr. Tan in November. In November 2019, there was some test, and finally they detect that there is lung cancer. Bangladesh diagnosed adenocarcinoma, and also Singapore Icon Cancer Center also diagnosis the same, that I have positive EGFR and lung cancer is confirmed. So doctor suggests me that you have medicine of this common type of lung cancer. No need to continue your normal chemotherapy. This medicine is enough to continue. As per the honest suggestion of the doctor, Mr. Tan, I purchased 3 months medicine from November to January. First time I was taken the medicine 3 months, and I was most likely a fittest man. Even it was not required to go to the doctor every day or a week. Just I undergo some test, and I send the test to Mr. Tan, and it was sustained that the medicine is working very effectively. Then February this year, I again report to Dr. Tan. He test. I undergo all the tests, and test reveals that my condition was improving, and he suggests me that this medicine is suitable for you. You can again purchase 3 months medicine. Then I again purchased 3 months medicine, and I was continuing. During these 3 months, I was not feeling any disease. Even I was the fittest man. I can take food, I can work, I can walk, I can do everything without the help of others. But it is my bad luck, the worldwide corona, COVID-19, in the month of May, the medicine was finished. And then I cannot purchase the medicine from Singapore due to corona and other problems. I request some cancer specialist and cancer survivor. They told me that Bangladesh Beacon Pharma can take risks. This same osimertinib 80. So I used to start this medicine from June, but after 15 days, there developed some problem in my body, appetite loss, hemoglobin level down, vitamin D level down, chest pain, appetite loss, and day by day I am becoming very weak physically. Now I am not very physically strong enough to work alone. Even I could not walk outside home.
Mr. Shamsul Alam, আমি আপনার এই ইনফরমেশন গুলো নিলাম। আমি এটা নিয়ে একটু ডক্টর তানের সাথে কথা বলি। আমি একটু ডক্টর তানের কাছে যাচ্ছি। Dr. Tan, as per Mr. Shamsul Alam, we got this point that is that the chemotherapy or the treatment for cancer is quite, harmful for health, or people feel more weaker due to this chemo. How to reduce the risk factor or the side effects of this chemo? I'd like to hear from Dr. Tan and then Mr. Azizul sir. Dr. Azizul sir, please sir.
Okay, first of all, Mr. Alam is not getting chemotherapy, is not getting what we call cytotoxic drug. He's getting this drug called osimertinib, and he was describing to you the wonderful experience and response that he had taking the tablet compared to the time when he was first given chemotherapy in Bangladesh. So I think my point is that it is important in this era in lung cancer that we need to always drill down to make sure whether we can avoid using cytotoxic chemotherapy, because cytotoxic chemotherapy is very powerful chemicals. It kills good and bad cells and cause nausea, vomiting, the hair loss, whereas targeted therapy, the side effect you can compare, you can ask Mr. Shamsul Alam, he says he can go back to work and he feels stronger and all that. So getting the right drug is very important, and sometimes, unfortunately, he couldn't continue getting the drug from Singapore because of the COVID and also the cost. He resorted to the locally made drug, and he found that there's a difference. So he just managed to get some drugs from Singapore, and I hope you, in a few weeks' time, tell me that he's back to his old normal self. So I think it is important to understand that getting the right drug at the right time, at the right place is very important.
Yes, definitely. So, Azizul sir, do you want to add something?
Can I supplement a little bit?
Sure.
Thank you very much. Actually, because we have learned, heard the history from the patient. Actually, what happened? Initially, Shamsul Alam was diagnosed as pleural effusion. It is definitely, but in the pleural biopsy was done, or the pleural fluid aspiration was done, but at the same time, we have also done the choroidal biopsy also. As because we also advised for second opinion from Singapore, we collected the tissue sample from the cord tissue, and it was a small tissue. That's why we did not test over here. Just we have done the cytological test from the pleural fluid, and it was a case of metastatic adenocarcinoma from the pleural fluid. But whenever he went to Singapore, we have given the sample, because if we test the sample, it may not be possible for the Singaporean histopathologist to get. So we have given the whole sample, and then again they have done the test, and it was found adenocarcinoma, and it was EGFR positive. And before that, actually he had effusion, massive pleural effusion, and it was a stage of whenever there is the visceral crisis, pleural effusion and peritoneal effusion, that time we have given pemetrexed and the paclitaxel, and you know that definitely all the cytotoxic drugs they cause weakness, but pleural fluid was reduced, and after the chemotherapy, pleural fluid subsided. Thereafter, I do not know that he developed pleural effusion. Possibly there still he doesn't have pleural effusion, but as it was difficult to collect the branded drug, then we advised as the COVID situation started. So we also told to explore any of the drug from the country, and it was the osimertinib, as the Dr. Ten told, and it was the Tagrix. So actually now maybe the because of the drug, or maybe sometimes at times the drug may be resistant, or the drug may not be working. So we have to evaluate again after taking the drug from the good source, as per the advice of the Dr. Ten. I think all of you have understood what happened, maybe due to the side effects or maybe the other reasons. We have to evaluate. Thank you very much.
Sure, thank you.
Thank you. Yes, that's why he already got the medicine. I think it will work good. So we have a question from the audiences. Already we got a few questions. But before of that, I have a question from my side. That if any patient, I mean, how to differentiate with the symptom of COVID, or if it is a COPD, or if it is a lung cancer, how to differentiate with the symptom? And if any patient experiences any symptom like this, like lung cancer, during this pandemic, what they should do right now? What should be your advice?
Right. It is a very good question. The question was also asked by my another patient's daughter. One of my patients from Borishal, he was my patient for about 5 years. The father of that patient, father of this the girl or lady, he was a case of adenocarcinoma before 5 years, and he survived possibly 3 to 4 years with the TKI, and that was a case of EGFR positive carcinoma. And after the COVID onset, one of his uncle started suffering from the fever, cough, and the respiratory distress. The lady is an advocate practicing in the Supreme Court of Dhaka. He thought that his brother died of the lung cancer. Maybe his uncle may be suffering from the lung cancer. Then I told, okay, you do some test and let me do. And she did only the X-ray test, and I have seen that X-ray. There was the homogeneous opacity in both the lungs, and there was no pleural effusion. And he has the respiratory distress, but he has fever also. But in the lung cancer, usually fever is very unlikely. You can ask to our Shamsul Alam. In the lung cancer, the fever is very unlikely, and the breathlessness is also very less. And unless there is severe involvement of both the lungs. But in COVID, the oxygen saturation falls very soon, even without any respiratory distress. So this is the typical criteria of the COVID. There will be dyspnea, there will be fever, and the oxygen saturation will be less. without any significant the chest pain or symptom, which we call the happy hypoxia. Happy hypoxia is one of the significant features of the COVID pneumonia, because the patient doesn't have any chest distress, no significant respiratory distress, but oxygen saturation falls down. So in lung carcinoma, there is usually there is effusion, but in COVID, usually there is no fusion. And as there was bilateral involvement of both the lungs, it is more common in the COVID pneumonia, but usually lung cancer may be bilateral, but usually in the single. And in the lung carcinoma, there is fever is unusual, but in the COVID situation, fever is the common features. And the hypoxia in relation with the respiratory distress, the oxygen saturation is less in the COVID pneumonia in comparison to the respiratory distress. So these are the differential points between the lung cancer and the COVID pneumonia. Ultimately, the uncle of that lady, he was treated with the COVID with drug, and the uncle has become all right. Now they are happy. Thank you very much.
Sam, do you want to add something with this to differentiate with the symptom?
Yes, you asked a very difficult and a very common problem. And actually, sometimes you need to make a distinction. And unfortunately, the only way you can make the distinction is to do the swab PCR test. So if somebody comes in with cough, fever, and changes in the lung, and on the CT scan, the distinction between lung cancer and COVID pneumonia is looking almost the same. So the only distinction you can make is if you can do a nasal swab test for PCR for COVID, then once it is positive, then you treat for COVID. Unfortunately, as you know, as our Major General tells you, there are some drugs, but some of the drugs are very expensive and they're still experimental. So you got to treat what is treatable first. And then after the patient gets better, recovered, then if they don't get better and if the shadow is still persistent, then you have to do biopsy to see whether it is a lung cancer or it could be tuberculosis or other pneumonias. So it becomes very challenging for the frontline doctors in making the distinction between lung cancer and COVID pneumonia and other types of pneumonia. So you need a lot of clinical skills and suspicion, and probably our Major General Azizul Islam has seen a lot more COVID patients than I have, because I am in a very protected environment.
Yes, we want you to
right. Just 1 minute.
Yes,
1 minute. Actually, that was the very high peak season of the COVID in the month of May. Just he talked me over phone. The lady, she was telling that my uncle is very sick, and they were scared of even movement that time. There was a peak time. There was a high mortality due to the COVID. And ultimately, after doing the CT scan and X-ray chest, after having some drugs, the patient improved so dramatically that they did not need to come to me, and I have not seen the patient. So you see, it is our country. We have to treat like this. I have given the treatment with the telephone and the Viber and the WhatsApp, and ultimately the patient became all right. They did not need to come to my chamber also. So this is strange. It is possible in Bangladesh only. It is not possible in other countries. Thank you very much.
I will come on this point with Nazmus sir. But before of that, I'm picking a question from our audience. Then I will come to Nazmus sir about the mental health, and people gets worried whenever any diagnosis comes, whether it's cancer or anything. So what should be the advice for them? So let me pick up the questions, then I'll come to you. So we have a question from a patient that, please tell us about treatment, prognosis, and fact of mesothelioma of the lung.
Answer the question, then the most experienced lungs cancer specialist, that is, I will request Mr. Tan to give the appropriate answer.
Okay, all right. Okay, first of all, mesothelioma is a very uncommon type of cancer that involves the lining of the lung. So you should always look for history of exposure to asbestos. Asbestos is one of the causative agent, not smoking or anything. So if it is none, and if the pathologist is very sure, depends. If it is early stage, you like to try and do an operation, but oftentimes the diagnosis is made in the late stage. You can use chemotherapy. And about 2 weeks ago, in an international meeting at ASCO, there was some announcement that immunotherapy may be useful for mesothelioma. But to me, that hasn't been FDA approved yet. But I would say the standard treatment is to use chemotherapy using pemetrexate and either carboplatin or cisplatin.
Right.
Thank you, sir. So, Alok bhai, we're talking about the panicking on the situation. So, মানসিক যে মানে স্বাস্থ্য ব্যবস্থা, or should they panic right after I mean, without diagnosing, just with a symptom, since you were a cancer survivor, what should be your
Firstly, একটা ক্যান্সার যখন একটা পরিবারে হিট করে, তিনটা জিনিস হয়। সবচেয়ে প্রথমেই there is a physiological strain within the patient himself. 2 নম্বর হচ্ছে একটা financial strain within the family of the patient. আর 3 নম্বর হচ্ছে the emotional strain. এবং ইমোশনাল স্ট্রেনটাই কিন্তু আসলে বিপর্যস্ত করে দেয় গোটা পরিবারটাকে। ঠিক আছে, কারণ সবাই ধরে নেয় যে এটাই, আবার যেটা বলছি যে এটাই শেষ। কিন্তু বারে বারে আমি একটা কথা বলছি যে আমার ক্ষেত্রে আমি যদি বলি, আমার সবচেয়ে বড় যেই সাহায্যটা আমি পেয়েছিলাম সেটা ছিল আমার ডক্টর থেকে। কারণ আমাকে তো দিনের শেষে, আমি ধরে নিচ্ছি যে আপনি জেনেছেন আপনার ক্যান্সার হয়েছে। আপনার প্রশ্ন তো তাই না ফারজানা, যে ক্যান্সারটা ধরা পড়ার পরে মানসিক অবস্থানটা কি হবে, তাই তো? রাইট। সো অবশ্যই আমি আবারও বলবো যে there is no better state than prevention, এবং প্রিভেনশনের জন্য যা করার আমাদেরকে করতে হবে সেটাই আমি এর আগে আলাপ করেছি, অ্যাওয়ারনেস এবং অ্যাওয়ারিং yourself, অ্যাওয়ারিং others. Now coming to the cancer, যদি হয়েই থাকে, সবচেয়ে বড় ওই মুহূর্তে বন্ধু, গাইড, মেন্টর হবে যার আন্ডারে আপনি চিকিৎসা নিচ্ছেন। সৃষ্টিকর্তার উপরে আপনার থাকতে হবে সম্পূর্ণ কি বিশ্বাস, আর আপনার ডক্টরের উপরে থাকতে হবে আপনার কনফিডেন্স। এই দুটা হচ্ছে সবচেয়ে বেশি ইম্পর্টেন্ট, এবং আমি এই দুটা আমার ছিল বলেই হয়তো আমি এটাকে উত্তরণ করতে পেরেছি, এবং আমারটা ছিল সেকেন্ড স্টেজ। নাও একটা কথা এখানে আসে যে আমরা যখনই জানতে পারি যে, তখন করি কি আমরা ফার্স্ট প্রথমে আমরা গুগলে যাই। গুগল, we want to learn everything from Google. Without any reference, we must not indulge ourselves into learning anything and everything about our cancer from anywhere. We have to go to the authorized and the right authority and the right mind of people যারা নাকি ক্যান্সার সম্বন্ধে জানেন, যারা এটা প্র্যাকটিস করেন, যারা এটাকে এক্সারসাইজ করেন, তাদের কাছে যেতে হবে, এবং দ্যাট ইজ দ্য ডক্টর অর দ্য কাউন্সিলর হিমসেলফ। আর আরেকটা হচ্ছে, এটা হচ্ছে the medical side or the practical side of it. On the other side, there is a reality of, সেটা হচ্ছে আপনার মানসিক অবস্থান, নিজের মানসিক অবস্থানটা। বিকজ আপনি একটা অনিশ্চয়তায় আপনি ভুগবেন, তখন আপনার ডিপ্রেশন হতে পারে, আপনার ভীতি হতে পারে, আপনার নানা ধরনের চিন্তা হতে পারে। এটাকে আপনি জয় করার জন্য যে জিনিসটা আপনাকে করতে হবে সেটা হলো নিজের উপরে বিশ্বাস আনতে হবে। নিজের উপরে বিশ্বাস আনতে হবে এটাই যে না, I am that part of that 70% or even 80% or even 90% who survive now. Because the treatment has become modern, the doctors have become efficient, and the medical condition in Bangladesh have become absolutely competitive and state of the art, supported by other foreign doctors. So আপনাকে সব ওই বিশ্বাসটা নিজের মনে আনতে হবে যে না, I will come out of it and I will be through it. So আমার মনে হয় যে এই দুটা জিনিস যদি থাকে তাহলে একটা হলো সৃষ্টিকর্তার উপরে বিশ্বাস, আর ডক্টরের উপরে আস্থা, আর নিজের মানসিক জোর যে I can come out of it. There are others who have come out of it and I am part of it.
Yes, sir. And you are someone, a true inspiration to the audiences, cancer patients or cancer survivors. Already they can see that how actively you are working for the Cancer Trust, your organization. Extremely inspiration for us. Thank you so much. And lastly, we have numbers of questions now. So to the audiences, if you have any questions later on, you can ask to our Facebook page, IMIC. You can keep those questions and you can ask to our doctors. They can answer because the time is very short for us. Lastly, I would like to hear from all the panelists, what should be the advice for the cancer patients and cancer survivors during this pandemic? The last few words, starting from Dr. Khan and then Dr. Aziz sir, and then I'll hear from Alba Bhai, please.
Thank you very much. Actually, in these COVID pandemics, as we know that, as per the very learned speech of our Dr. Mr. Nazmut, he has told that actually, really, prevention is better than cure. So we must understand, we must realize, even lung cancer, 80% of lung cancer is preventable. And overall, 2/3 of the 1/3 of the cancer of the all organs, that is 1/3 of the total lung cancer is preventable, 1/3 is curable, rest 1/3 needs the maintenance treatment. Similarly, COVID is 100% preventable condition in infectious disease. So first of all, we have to believe that if we maintain the particularly the health discipline for the COVID virus. For example, if we really maintain the social and the physical distance, and we use the mask properly, particularly the health workers must use the proper mask and the other personal protective equipments, and hand sanitizer is also very important. These 3 factors are very important if you can prevent from the COVID pneumonia. Even then, I think we should not worry, because in our country also the COVID treatment is found to be very effective and the mortality is almost very less. So even then, if you suffer from the COVID pneumonia, it is curable, but some patients are particularly vulnerable. For example, the patients who are suffering from the different immunosuppressed conditions like diabetes mellitus, the COPD, the chronic kidney disease, chronic lung disease, chronic liver disease, and different types of cancers. These are the poor prognosis factors, As well as another very important we have seen, the obesity is another important factor for the COVID pneumonia, the risk factor. So particularly this group of people should take the utmost precaution regarding this social distancing, sanitizer using, as well as the using of the mask. And I will also I echo with the Dr. Tan. Even in COVID situation, particularly metastatic cancer, if we can diagnose the patient, we can detect the histopathology, including the cytogenetics and the immunohistochemistry. We can treat the patients very well with the less toxic drugs, particularly the targeted therapy like different types of tyrosine kinase inhibitors. And with the tyrosine kinase inhibitors like imatinib, the crizotinib, this alectinib, the adenocarcinoma, and the other lung cancers are their survival rate has increased, and the prognosis is very good. And I will request all of us to take precautions so that we do not smoke and we hazard all the environmental pollutions for prevention of the lung cancer. Also, we take the proper preventive measures, health measures, so that we are not infected by the COVID pneumonia. Thank you very much.
Thank you so much. So, Dr. Tan, I will hear a few words from you, last few words. But before of that, one patient is asking, is there any interconnection with the lung cancer and the brain cancer? If any patient diagnosed with the cancer in lung, is there any possibility he can have the cancer in brain? So, if you can get by.
Okay, maybe I answer this question, then I will give my closing comments.
Yes,
there's no question about 10 to 15% of patients who were diagnosed to have lung cancer at the time of diagnosis, if they have advanced stage, would have already cancer spread to the brain. The brain is a very, what we call a protected area, and it's a very silent area. And sometimes in my practice, whenever I make a diagnosis of advanced lung cancer, I always have to scan the brain to see whether the cancer has already spread. Even if it doesn't spread, along the treatment, you should periodically look to see whether it has spread to the brain, because a lot of anti-cancer drugs, whether it's cytotoxic drugs or what they call targeted drugs, they don't enter the brain very well. And so sometimes some patients may need radiation to treat their cancer. But fortunately, some of the new targeted drugs are showing better response for those that has gone to the brain. And our patient, Mr. Shamsul Alam, is a good example where the drugs can enter into the brain. So I think it is important that there is a relationship between lung cancer and the cancer spread to the brain. My closing comments are, I think Major General Muhammad Azizul Islam has given very good advice on how to prevent COVID. As you know, when COVID came into the world in January, February, all of us were blind. All of us were not sure where this virus comes from and how the virus spread. And in fact, there were a lot of criticism, like in Singapore, they say no need to wear masks unless you are healthcare workers or unless you have symptoms. But it didn't take very long for us to realize that wearing a good, proper mask is very important. And having any symptoms of fever, cough, breathlessness, you have to quickly go and see a doctor to rule out COVID. And sometimes we are beginning to realize that there are many people who carry the virus but don't have the symptoms. So it is always important to keep what we call social distancing. Don't stand or stay with people you don't know well too close, because they can pass the virus to you and you can die from it if you are not properly treated, So I think it is important to try and prevent, wash your hands frequently, social distancing, and then try to avoid crowded areas. I know in Dhaka and like in Singapore, it's very crowded. Everywhere you go, it's very crowded. You cannot avoid crowds, but if you have to be with a crowd, make sure you wear a mask properly and make sure the mask covers your nose. I see people wearing masks with the nose sticking out. I think it is might as well, it won't protect you because the entry for the virus is usually through the nose. And if your mask is not effective to block the virus, you can get it, So if you are unfortunate enough to have lung cancer and COVID, you have to treat your COVID first. And if you have lung cancer and don't have COVID, you must try to avoid, if possible, having chemotherapy because chemotherapy weaken your immune system and make you more susceptible to getting infection. In fact, the world literature has shown that those people with underlying cancer have a higher incidence of COVID and they die from it if they have a cancer as well as COVID, not just necessarily lung cancer, any cancer. So it is important, if possible, try and avoid drugs that cause the immune system. And if you are on targeted therapy, you can avoid going to the hospital. To me, hospital is not a very clean place because sick people go to hospital and you don't know who has got COVID. So if you can avoid going to hospital, it is better to avoid going to hospital. Likewise, radiation. Radiation oftentimes is a daily treatment. So if you can avoid, ask your radiation doctor to see whether they can shorten the number of doses of radiation so you can avoid going to hospital too often. So I think my departing point is try to avoid COVID. It is no fun to have COVID. We haven't got a very good effective vaccine yet, and we don't have very good effective treatment. And some of the reports of remdesivir and hydroxychloroquine, they are still not very definitive. And the best is to prevent getting COVID if possible. So these are my comments, and I hope all of you will stay well and stay safe and wash your hands.
Thank you so much. Thank you so much. So, Albab Bhai, last few words, then I'll finish my session here.
Actually, number one is, which I always say that there are two kinds of people. One kind is who just sit and watch things happen, and others who make things happen. So I think the world is in such a situation now. COVID, pandemic, you're actually fighting a ghost, to be very honest. You can't see the virus. You can't even see who you're fighting against. So that's number one. And number two, on the other hand, I can tell you this, that considering Bangladesh, where the cancer treatment is centralized, and all are Dhaka-based, they have already started, and there will be more kind of a surge of patients coming into the city going forward. So I think we need more volunteers. We need more private organizations who will come out and serve this particular community. And serving the COVID standalone will not help. Actually, COVID and cancer both have to be addressed together before this cancer becomes another pandemic 5 to 10 years from now. Thank you very much.
Thank you so much. Thank you all our speakers for your tremendous informative informations was for our audiences. I know everyone is panicking with the cancer, and these are the information will help them to fight the corona and at the same time the deadly disease like cancer. So just for your information, there will be a program webinar by Icon Cancer Center. You can follow our IMIC Facebook page to get this information. The webinar is on September 12th on battle against breast cancer. So you can have these informations from our Facebook page. Thank you everyone for joining with us. Thank you, Dr. Tan, for your time, Mr. Albab and Dr. Major Doctor. So thank you everyone. And finally, the last word to Dr. Tan. Congratulations.
Thank you. And thank you, Farzana. You are very good coordinator and MC. I'm very impressed. Very good. Thank you.
Thank you so much. So
thank you, Dr. Tan. Thank you so much. It's a pleasure having you, sir.
All the best. All the best. Take care.
Yes. Take care, our audiences. Take care, everyone. Thank you.
Thank you. Bye-bye.
You are watching Raj TV, Jagorone, Bangladesh. Please subscribe our